Hello, I'm Chris Galucci.
I'm Alexandria Murphy.
Hello, I'm Chengwei Huang.
And I am Francine Scarlett. Today we will be discussing the current state of retail or convenient care clinics.
Healthcare organizations are evolving away from a transactional model of care towards a more experiential model characterized by customer service, price transparency, provider ratings, and ease of use. There's a prevailing trend in the idea of increased access to medical service, a paradigm shift that healthcare delivery depends on being everywhere all the time, with understanding that consumers punish complexity and reward simplicity. For this reason, healthcare is moving towards a convenient care outpatient model in order to suit varying customer-patient preferences. Though the use of outpatient sites of service and amenities, including urgent care centers, retail clinics, freestanding emergency rooms, telehealth services, healthcare monitoring apps, and home health devices. According to recent data, walk-in medical clinics located in pharmacies, shopping malls, office parks, and workplaces are getting more popular with healthcare consumers. Out of 3,000 adults surveyed, 27% said that they have used walk-in retail or work-based clinics in the past 2 years. That number is up 7% from a poll conducted in 2008. People generally visit convenient care clinics for basic health services and free screening tests for diabetes and cholesterol. As a result, patients have begun to use the clinics for managing their chronic conditions such as hypertension, asthma, and diabetes to check their blood pressure, blood sugar, and cholesterol. The main reason why people choose walk-in clinics is convenience and affordability. Generally, these clinics do not require an appointment, they are conveniently located, involve only a short wait time, and are even open evenings and weekends, with some of them open 24 hours. These clinics also offer greater access to family practice and internal medicine physicians, two specialties that are particularly in short supply. Many health insurance plans are also now covering the cost of these visits. Even if they do not, the charges are generally in the range of an individual's copayment. Most walk-in clinics are staffed by licensed nurse practitioners who have the training and authority to diagnose standard illness and prescribe medication, while also delivering care that is both consistent and professional.
These convenient care clinics began to appear about 15 years ago to offer customers convenient, affordable, and tiny access to a limited scope of medical service on a walk-in basis. In the early stages, convenient care clinics saw very few patients and only accepted cash payment. After a few years of limited growth, major retailers and healthcare systems began to aggressively build this site of service to provide patients lower cost options and more efficient access to physicians and other healthcare professionals. Urgent care ownership is distributed among a variety of entities. Retail clinic ownership is more consolidated. As of 2015, 6 organizations, CVS, Walgreens, Kroger, Target, Rite Aid, and Walmart, operated 90% of retail clinics. The retailers retain full ownership and control of their clinic. They staff the clinic, retain all revenue, and bear all financial risk. Urgent care centers offer high-quality care for common illnesses and non-life-threatening procedures such as broken bones, colds, infections, cuts, or other injuries. They typically are staffed by primary care physicians and advanced practice professionals. Urgent care centers have an advantage over hospital emergency departments as they can choose patients by payer type and may elect not to see Medicaid or uninsured patients if these patients are not able to pay upfront. However, hospital emergency departments are obligated by law to see all comers, while some states require urgent care centers should be licensed. Most do not. 95% of urgent care centers are open 7 days a week, with 95% closing after 7 p.m. The average cost of treatment is $150, and most participate with major insurance plans. Urgent care centers, once dismissed as stuck in the boxes, now are a $14.5 billion business.
In contrast to urgent care centers, retail clinics are located in high-traffic stores and usually associated with pharmacy retailers such as Walgreens and CVS. These types of clinics do not provide highly advanced medical procedures, but rather screening diagnostics and the treatment of minor ailments. Typical cases that can present in retail clinics include blood pressure monitoring for hypertension, ear infections, sore throats, influenza vaccinations, and cholesterol readings. Most retail clinics are conveniently located in corner stores, and hours of operation can be as early as 8 a.m. and close as late as 8 or 9 p.m. Weekend hours are usually limited. As with urgent care, scheduling for appointments is unnecessary, and there has been a high rate of patient satisfaction. Conditions or treatments that are beyond the scope of the clinic are referred to a local general practitioner or an emergency department. As stated by Weineck et al., long wait times, limited after-hour care, and other barriers to health delivery access has led more Americans in seeking care at emergency departments for non-emergent conditions. This in turn has caused the typical wait time in the ED to increase, and some patients end up choosing just to leave without treatment. Though some studies find a small marginal cost of treating non-emergent conditions in the ED, others report those charges are significantly higher in the emergency department than in any other setting, and thus it increases the out-of-pocket costs of the patients, creating an added strain on national healthcare spending. It has also been stated that the industry estimates suggest that 13 to 27% of all emergency department visits could take place in an urgent care clinic, generating $4.4 billion in savings annually. Coincidentally, since the inception of the Affordable Care Act, more citizens are now insured and consequently increases the number of individuals seeking health care. Historically, the emergency room was the first choice for patients seeking acute care, and now the favoritism has been shifted to convenience clinics, which accept most medical insurances. This reduces the financial and time burden for consumers and therefore loosens the pressures on the emergency departments. By 2017, it is predicted that there will be a 14% annual growth for retail clinics. That's a 46% increase from 2014, when approximately 1,900 existed. At this time, there is a shift in the focus of these clinics, moving away from the retail element and actually expanding services by partnering with other health value chain players to maximize their patient volume. This will cause a profound impact on the overall profitability and serve as a key driver for future growth. New services that are being added, or likely to be added, consist of pediatric care, chronic disease monitoring and management, and transitional care, as well as the introduction of advanced medical equipment and electronic records management. Walgreens is one retailer that has expanded its clinic to include medication reconciliation for chronic diseases, as well as boosting the number of preventative health services that it offers. Walmart has followed suit with its interest in adding more sophisticated services. CVS now has electronic health records, which allow the transmission of clinical data to regional health exchanges.
Electronic health records play a vital role in the growth and effectiveness of these convenient care clinics. As electronic health records become even more widely adopted with increasing interoperability, coordinating care between different providers in these various settings will become easier and more effective. Healthcare access is maximized when physician offices, emergency rooms, walk-in clinics, retail clinics, pharmacies can share up-to-date information specific to each individual. With financial incentives from the federal government, plus the obvious benefits of electronic health records in improving safety, quality, and cost, This technology will enhance the effectiveness and convenience of outpatient care. To summarize, healthcare organizations are embracing a model of care that is focused on customer service, price transparency, provider ratings, and ease of use. The convenience, quality, and accessibility of retail clinics and other similar outpatient services has changed the way we seek care. Under the Patient Protection and Affordable Care Act, there has been an increase in newly insured individuals with greater demand for health services. The nation continues to face a growing shortage of providers, and there is a growing demand for these clinics, so companies like CVS and Target are investing in this type of healthcare supply to meet customer demand. Now, with widespread use of electronic health records, it is easier to coordinate care from these various sources, making retail clinics or convenient care centers one of the many faces of our future health care. Questions to ponder. Convenient care centers improve access and help to solve some of the problems associated with cost and provider shortages, but how should they be regulated? Possible answers. The Joint Commission. The Joint Commission is a well-established accrediting body. They describe themselves as an independent, not-for-profit organization, which certifies nearly 21,000 healthcare organizations and programs in the United States. Their published mission is to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. Second question. Does the increased use of convenient care centers decentralize patient care and increase potential drug overuse as patients travel from clinic to clinic for, say, painkillers? Is there an increased risk for prescription drug abuse? Possible answers. Electronic health records will make convenient care centers and retail clinics an integrated part of whole patient care. Drug use histories can be accessed and overuse intercepted.